This is a patient who's 23 years old and doesn't show enough teeth. The first picture was kind of what his smile's like, and he's trying to smile, but his upper lip is really holding his teeth down. If he scrunches his nose, he's able to do a better job, but he's not very interested in scrunching his nose like that. And he would like to be able to see a little bit better. This is kind of like halfway, and it's the teeth are covered. This is his normal smile, which makes him unhappy. The right canine is also a little bit longer. You can also see that the right lateral, number 7, has really never been worn down. Two front teeth are a little uneven. There's the frenum, or the very first portion of it. As we pull the lip back, you'll see more of it. I would recommend removing that first so that we could see how much tooth is revealed when the patient smiles. He's not unhappy in having not the perfect smile. Here's the back of his upper front teeth. He's had orthodontia for about 3 years. You can see the wear on his two central incisors from behind. There are his lower teeth, and the wear that's also from grinding that he's done. This is also the little video of his teeth, and you can see the little spot where he first touches on the premolar and canine. You can also see the stress fracture on the canine. And there's tooth number 12. There's the little stress fracture. A much better look at what that looks like. And when he really bites down hard, because we went back and used some articulating paper again, you can see that he's touching much harder there. We'll go ahead and put in some articulating paper and have him grind side to side, and you'll see that it lines up exactly where that stress fracture is on the canine. Probably would be a good idea to adjust the bite just a little bit. He really doesn't have a slide for the most part. It's not more than like 1/10 of a millimeter, but when you go ahead and have him bite down hard, you'll find that his masseter muscles really are developed. There's the little grinding right where that stress fracture is, and you can see also the wear on his central incisor where there's that little chip.
Hold hard.
Then we go ahead and check the bite here. You can see how the teeth.
First feel it touch there. Right down hard.
Okay. And it's almost imperceptible what you see in terms of that. Here he is grinding his teeth. You can see how his upper teeth are being formed up against there when he goes side to side. And that's what's putting the pressure on his teeth.
Your jaw forward. He's pushing teeth forward. Go back.
It's off of his front teeth, which we saw where the wear was before.
Pretend you're going to bite your nails. Push your jaw forward. Move your jaw like you're going to bite your nails.
And you can see how much room there is for the lateral. Number 7, if we wanted to add some composite. But he's really touching more in that left area.
Right there.
And it's very important to be able to determine how he's grinding his teeth so that we know how much space we can add to the lateral.
Chin down just a little bit.
And that's right where that little chip is where he's got the tooth touching. And then when he continues to go, he is wearing down the adjacent teeth. Incisor.
Right there.
There it lines up perfectly where that stress fracture is. And truly, he should be wearing some sort of appliance at night, which would be a simple fix, and it would wear down the plastic hard acrylic night guard, as opposed to just a regular retainer. Now, one of the situations we could do to fix the smile is to do orthodontia like Invisalign, and that is a possibility. The problem with that is it's sometimes very difficult to get the teeth together the way we would like. There's the frenum again, and I would suggest removing that, seeing if the patient likes the resulting reveal. If he wants to have orthodontia, we could certainly do this. This is the treatment plan. If you wanted to reduce the reverse smile, we could always recontour it. This is a patient that had the same problem where their lip was really trapped by their frenum, and we went ahead, this is as good as she could smile, and we went ahead and removed the frenum, and we're able to get a significant amount of reveal. That's really a relatively easier procedure. I always recommend doing it with a laser as opposed to radiosurge because it's less painful, and you can see how much she can see right now in terms of her teeth.